Good afternoon and welcome to the Beyond the Blueprint webinar series. This series empowers health IT professionals with the latest insights, strategies, and design principles required to seamlessly integrate digital tools within their projects. Whether you're embarking on a hospital remodel, constructing a brand new facility, or undertaking a targeted renovation, technology and innovation are playing an increasing role in shaping the future of healthcare delivery. In this series, we explore how to integrate leading-edge technologies and design processes to enhance patient care, optimize operational efficiency, and to drive a positive and compelling ROI. My name is Greg Malkery. I'm the Managing Director at Spyglass Consulting. I'm also the host for this series. Joining me today is my co-host, Keith Washington, a renowned serial entrepreneur and respected board member at Companions in Courage. Keith, welcome to the studio. Do you have any opening remarks?
Yeah, Greg, so I'm really excited about today. So we've talked about this several times in the past, how design through the Beyond the Blueprint conversations with our guest speakers is all about managing complexity. I think today we're going to be talking about some really compelling topics about how you design and develop a clear vision for your future and how you communicate that to an organization and how you get all the stakeholders aligned. So really excited about how we can use communications technology and storytelling to align all the stakeholders, the staff, patients, suppliers, the whole ecosystem. So very excited.
Great, thank you, Keith. Also joining us today is our guest speaker, Tim Jones, co-founder and CEO of HealthNuts Media. He's also, by the way, I just recently found out, an Emmy Award-winning writer and producer. Tim, welcome to our webinar. Would you like to introduce yourself?
Sure. Yeah, thanks, Greg. Glad to be here. My name is Tim Jones, as you said. I'm the co-founder and CEO of HealthNuts Media, so we specialize in storytelling in healthcare. We've focused a lot on pediatrics, so we've produced more than 500 animated videos that are used in hundreds of hospitals across the country, just to help kids and their parents better understand and manage their health care. But animation and storytelling isn't just for kids. So we've recently done a lot of work for the VA, trying to help veterans better understand and manage the complexity of the largest integrated U.S. health system in the U.S. So really spans the range, and happy to talk a little bit more about how storytelling can be used in healthcare.
Great, thank you, Tim. Now, before we dive into our discussion, I want to express my gratitude to our valued sponsors, Simplify Medical and Storage Systems. We also have here in the audience Lars Anderson from Storage Systems. Lars, please share a brief welcome.
This is Lars Anderson with Storage Systems Unlimited. We're a distributor of a number of different storage items, including telehealth carts, partner with our good friends over at Simplify. So looking forward to a nice education here on how things are developing and where we're headed.
Now, during today's webinar, Tim is going to discuss how effective storytelling can help transform patient education and engagement. He'll identify how digital storytelling can simplify complex health topics. He'll demonstrate through case studies the positive impacts that storytelling has on outcomes. He'll explore strategies on how to effectively implement storytelling within different health settings and highlight the role of narratives in motivating healthcare teams and enhancing engagement. So with that, why don't we get started, Tim? Let's start at square zero, or square one. What exactly is digital storytelling, and how is it being used in healthcare settings today?
So that's a great question, and I think in the vernacular of Beyond the Blueprint, it's communication by design. So there are many different ways to communicate. Obviously, as human beings, facial gestures, body language, we can communicate in that way. But humans have developed a very large vocabulary and a language that we can get much more specific about what we're trying to communicate to each other. And then storytelling is a very specific way, a designed way to transfer information from one person to another to make a a greater impact. So that really, in a nutshell, is what we're talking about. So when we step back and look at what that means in healthcare, the last time in our last webisode, we talked about how reality itself is the story we tell ourselves. So everything that happens to us, we have to process and make sense of it. And so we tell a story. I also talked about Arthur Frank, who wrote a book called The Wounded Storyteller, in which he wrote, "The body sets in motion the need for new stories when its disease disrupts the old stories, forcing the patient to learn and think differently." So when we get sick, when we get injured, when we enter into the healthcare system, that's when things start to change. We're trying to make sense of what happens, and then the healthcare system, in a sense, is co-authoring that story. And so what we want in an ideal scenario is for the patient and for the healthcare system to be on the same page and to be writing the same story. And unfortunately, a lot of times, that's really not the case. And so it's an enormous responsibility for the healthcare system to understand who that patient is, understand where they are, where they're trying to go, to provide that information to help them have a good outcome, to have a good experience. And by communicating with design, and specifically in the context of our conversation today, using some of the storytelling techniques, we can show that that can be effective. So let's, I guess, break that down a little bit, get a little more personal. Greg, I understand recently you've had an experience where you entered into the healthcare system unexpectedly. So let's take a look at that and break that down and look at how storytelling was or was not used properly and what might have been different. So what happened to you?
Great. Yeah, everything's always in the eyes of the beholder. Let me tell you about my recent injury. I'm part of a ski cabin up in North Lake Tahoe, and during the winter of 2023, we had perhaps some of the best skiing and snow conditions in more than 50 years. In fact, every time it would snow, it'd be 5 feet at a time. Now, during a blizzard in February of that year, we had a 7-foot snowfall, and after arriving at the ski resort, I am so excited to get to the lift. So I'm walking in my ski boots and my skis on my back, and in the parking lot, I slip and fall. Very non-eventful, and I fell into a foot of snow. Unfortunately, I couldn't get up, so the medics transported me to the local community hospital in downtown Truckee, and the care team ruled out a broken femur, which is a blessing, and a hairline fracture. And the ED doc says, "Don't worry, it looks like you're going to be okay, and you could return to skiing as soon as you feel better." So within 2 weeks, I started skiing again, and in fact, I'm skiing every weekend for the duration of the season, with minor level of leg discomfort. There was no way I was going to miss out on the best skiing of the century. Fast forward to May, I have a huge bulge on my leg, and I can't imagine what it's from. It's right on top of my quadricep muscle. My wife, who's a nurse at a San Francisco Bay Area Medical Center, says, "No, you have a hematoma." So I get my massage gun out, and I'm trying to break apart the blood under the skin. It's not working very well. So I thought, you know what, I need to see the sports medicine person. So I meet sports medicine physician Sally. After examining me, she indicates, "I got some bad news for you. It's not a hematoma." I go, "What?" And she goes, "Look, feel along the muscle band. You got a hole in your leg, and that's actually your muscle, and it's all curled up." It is as creepy as it sounds. So she referred me to an orthopedic surgeon for treatment.
Wow. So I guess in the terms of storytelling, that's what we would call the inciting incident, right? So you're living your life, everything's going along well, and then bam, suddenly something changed. You're faced with a crisis, and now you need to start telling a different story about what's happening with your body and with your life. So you may remember last time we talked again about Arthur Frank, the wounded storyteller, who broke down. He said basically in healthcare there's three big narratives that that people fall into. The first is that restitution narrative, where you are injured, but through this journey you get back to health, you get back to life as normal. The second is the chaos narrative, and that's where nothing makes sense, and you don't have recovery, and you're just stuck in this never-ending, shifting confusion of healthcare, and it's just chaos. And then the third is sort of a quest narrative. So this is where the journey isn't necessarily, hey, I'm going to recover from from this illness or injury, but through this, I'm going to learn something very important about myself. And those, in broad strokes, are the three sort of popular narratives that most patients fall into. So I guess what narrative do you see yourself in, or did you see yourself in?
Well, based on my three options, because I only got
right.
I'm
Everybody wants number one. give me your number one.
It's actually an example of a restitution narrative. My goal: fix the problem, get back on the slope so I can ski or exercise as quickly as possible.
Great. So now healthcare comes into the story. So now they're co-authoring your story and trying to help you tell that restitution narrative. But as we talked about before, it's almost impossible to do that if all you're doing is looking at diagnostic codes and what you're there for. You're more than just the injury in your leg, right? You're great. You've got a lot more to you than that. And so that's the first part that healthcare really needs to get better at. And this is nothing new. Over 100 years ago, they started something called narrative medicine. And this was the idea that when we come in, we talk to Greg and ask him, what happened and what's going on with him. We're going to use the same techniques that we might use to analyze a novel, to analyze Greg. He's, look at this, look at this story that he's telling. There's a plot line, there's characters, there's metaphor, there's a lot of information there that we can analyze and pick up on and learn a little bit more about what Greg is all about. And then using those same techniques, we can help him co-author this story so that he is on this restitution narrative, that he gets better, that he doesn't fall into the chaos narrative. So that's the basic sort of premise and the setup of what we want to understand when we talk about storytelling. So anyway, let's move on. So what happened next?
Yeah, so to continue with my story with the sports medicine division, I'm very detail oriented. So I asked her, hey, look, can you provide me some educational material so I can learn about my injury and treatment options? Because all I know is I have a hole in my leg, but I don't know what actually happened. So she directed me to the Epic MyChart patient portal, which I think many of you have seen. And I'm fairly technology savvy. I looked under every menu. I could not find a single ounce of educational materials on anything within the Epic portal. So I was forced to improvise. So I went to YouTube and spent several hours reviewing videos about quad ruptures, surgical interventions, and rehab care plans. The material was actually quite good and actually fit my needs. Now, if I was to ask the medical center, none of this was curated or approved by the medical center, but it gave me the information that I needed. So fast forwarding from May, I finally get in with with an orthopedic surgeon, Chris, who, by the way, is a former team doctor for the Oakland Raiders, so I have some level of confidence he knows what he's doing. And the ortho surgeon indicated that I was actually 6 months late in getting the surgery. In fact, I'm supposed to have gotten the surgery 1 week after the injury occurred. So he said there's a risk that the surgery may not be successful. So, and the procedure is, look, go in there, cut my leg open, pull the muscle down and reattach to the knee. It doesn't sound too pretty. Now, before and after surgery, I'm still dying to get information, right? So I asked the surgeon's assistant for some educational materials. He indicated that there was none available and that if he had time, and that's a big if, he'd send me some text-based articles. Those articles never came.
Wow. So first of all, I'm sorry to hear that. That's really unfortunate that this is the experience that you've had, but I think it sort of underlines some of the principles that we're talking today. You want to write a restitution narrative, and really your healthcare system, even though they're world class, and from what I understand, that you've got great doctors and world class clinical care, but the story that they're co-authoring with you is sort of sending you into this chaos narrative. You're confused. You don't know you don't know what's going to happen. And now you have to go off and sort of hunt and peck for yourself, which is not what, it's clearly not what should be happening, right? So, in some ways you'd say, well, geez, if this was a comedy movie, is this planes, trains, and automobiles? So you're an analyst, your job is to work with these world-class health organizations to help them, manage change and do all this great stuff. But then when you actually interact with this organization, you find out that all the big goals and all of this stuff sort of fall by the wayside because either they don't have the time or it's not the priority or something. And that's not the story you want to be in. And I'm sure that's not the story that the healthcare system itself wants to be a part of either. So really, I think this underlines the basic importance of taking this very seriously. I mean, this is something that you will carry for the rest of your life, and you will have these memories. I think by talking to you, you're, on the road to recovery with your leg, and hopefully you'll be back on the ski slopes next year. But this experience that you've had will leave a negative impact and a negative memory forever. And the people that you talk to and everything, that's now part of the story. And that's really, that's really unfortunate. So I guess let's talk about what happens next.
Well, yeah. So before you go on,
Sorry.
Tim. So what I'm going to do is say I think you've set this up really well, maybe to have a conversation from the health system's point of view. What could the health system have done for Greg such that he didn't have to wait 6 months, that he got it a week later, like they've anticipated, right? So I guess in your experience, Tim, because you just did all this work with the VA, right? So you had to lay out, and obviously the VA, as you said, very large integrated health system, all kinds of service lines, all kinds of care settings. It's not Greg Malkery's job to know which path he's supposed to take, right? The health system is going to coach him through that process. So,
Exactly.
so as part of the, say from the health system's point of view, the story they want to tell is a success story as to how as soon as Greg had his injury, they anticipated all these downstream challenges and they helped Greg navigate the complexity of the health system with a clear, concise vision for this future state of he is going to be a success story. So in your experience as a storyteller, how do you, say, advise the sports medicine profession as to how to stay ahead of this so that they can start to say, well, wait a minute, it's not Greg's job, it's our job to communicate these ideas?
That's just it. So I think it's in some ways, sort of business as usual. So, let's maybe if we have time, we can, print something out that Greg may or may not understand. So in the larger, scheme of healthcare, we look at literacy and health literacy, and we know that only 12% of the US population has proficient health literacy. So the whole idea of, hey, you've got your, patient education materials or your summary, we put it in a folder and gave you a 100-page, document that makes no sense, really serves no one. So in some ways, it's, looking at the basic ways that we, deliver that. And that's why we work a lot in non-written forms of communication, just for that. Also, we talk about, well, just that data dump doesn't really do anyone any good. So if all they did was dumped data on Greg, as far as based on the 100,000 other people that have had this surgery and this and that, like, it really does him no good. And that's where we talk about communication by design and understanding storytelling, so that Greg leans in and says, so what now? Oh, I understand. So in the scheme, or in the, I guess the VA, a lot of what we did wasn't really hardcore patient education, but sort of healthcare navigation. And really what we found, and the data bears this out, is VA actually delivers better clinical care than hospitals, what they call in the community. They do a really good job, but the perception out there is, oh, VA, and so even the veterans, when they start to break that down, it does come to, similar to what Greg went through. Clinically, they did a great job, but I was so confused about what was supposed to happen and what was supposed to happen next. And I was confused, and I was stuck in this chaos narrative that I really have no idea what's supposed to happen and what's supposed to happen next. And that really negatively colors the story that, that veterans or Greg writes for themselves, and then overflows into that broader perception of, well, they've got a bad reputation, or the story about the VA as well, don't go there. They're not good, and that's just not the case. So in that sense, my perspective is that when you manage that complexity and that communication better, it's better for the organization, it's better for the patient, it's better for everyone. And quite honestly, that idea of narrative medicine, really, medicine, I don't think will ever not be one-to-one, really. So you're talking to your therapists and your nurses and your doctors, and really the empathy and the knowledge and everything that they provide, that's key, and that's always going to be the case. But as these systems get larger and larger, and what you hear from everybody is, I wish AI would take all the complexity and handle some of that, so that I could just spend more time with my patients. And so a lot of times that's what we're talking about, because we know we're either in a waiting room or in a hospital bed. There's a lot of time that we're just waiting around for that doctor or nurse or therapist to come in and spend the time. And if we can use that time more constructively to educate you, to set your expectations, to help you write that restitution narrative, keep you out of that chaos narrative, everyone's going to benefit from that.
Yeah. So I can pick on Greg a little bit. So I guess if you're a sports enthusiast and your sport is to defy gravity going down an icy hill at 30 miles an hour, don't you think maybe you ought to anticipate that sports medicine is somehow in your future? Like, that's something you ought to be prepared for? Like, how is it you just, as an afterthought, oh, well, this could never happen to me? Like, as a patient, what would you tell yourself before your accident? Like, what should you have done so that when you got involved with the health system and you didn't know you had to navigate complex health system navigation, but now like, what would you tell yourself?
Hold on, this is a really good point. Just an aside here to note to Tim. Tim, I've got some great videos of insane mountain bike accidents and ski accidents I want to incorporate in. Because
up a really good point.
I think it's the same premise, right? Mountain bikers will go over the handlebars. It is just when. It's when. It's not
actually
if. There's
worse
no
than
if.
you can imagine. Head first into a tree,
Yeah. Skiers are you're going to fall. Gravity is going to win. There's just no way around that.
Well, the irony is because a lot of the patient education companies are my customers, right? So I told them about my experiences. I go, that's really weird. That specific medical center XYZ, they have an enterprise license for all of our stuff. I go, really? Why am I not seeing it? And the surgeon's assistant actually told me, like, they don't have time to look for it, right? So you better ask the right questions in those 6 minutes you're with them. And yes, he is providing you that information, but you as a non-medical professional have no idea what the hell they just said.
Right.
So my solution, being more data-oriented, I improvised. And they complied because they knew they weren't delivering the information. And to go back to the discharge binder, right? It's 100 pages of gibberish, right? That's why you find the trash cans outside the medical centers full with binders because it's useless information they're providing, but required by regulatory agencies.
Right, right. So, that really is frustrating. Obviously, you had to help yourself, right? So like you said, you went out, you searched for this information, you tried to, ask the right questions and educate yourself. You were able to overcome this. But not everybody is as, educated or as fortunate as you. And unfortunately, that's what we see in healthcare, that, people fall through the cracks, right? And they get stuck in this chaos narrative that no one is helping them. No one is answering their question. My condition isn't getting any better. And I just really don't understand why. Right. And so what are I think that's where we're going. What are the alternatives? What can we do? How can we, help tell better stories? Recently, I had my mortgage company sent, or actually, I had two experiences. One, I went to my doctor for my annual, checkup, and everything's fairly normal. I can, again, going to my patient portal, I can see all my test results basically the same day. But it gives me no information. I have, it may make sense to the doctors what that blood test was and what this means, and maybe I feel comfortable when I'm in a normal range, so I'm not that concerned. But some are outliers, and what does that mean? This portal gives me absolutely no information, and I have to do the same thing. I have to go out onto, Dr. Google and start asking these questions, and then going, is this a reliable source? What? And quite honestly, why isn't my system trying to put some context around this? By comparison, my mortgage company annually says, okay, I pay my principal and interest, and I have an impound account for my property taxes as well. And so property taxes go up and down, mostly up, but once in a while they'll go down. But that your mortgage payment may change depending on that, and that can also be kind of complex. And if all they did was sent me a 15-page written summary about all of that, I might have just thrown it away and not understood. And but they sent me a link and said, hey, we've got a short video. Do you want to watch this? Do you understand what an impound is, or should we skip forward? And I thought, I think I do, but I'm just, professionally kind of curious how they tell this story. And the video starts, and hello, Tim, and you live at this address, and here's your total, and here's how much you pay every month. And now your property, tax last year was this much. Next year it's calculated to be this much. So here's all of these numbers, and here's, starting on June 1st, here's how much your mortgage payment will be going forward. And it was a 2-minute video, and I thought, wow, that was just fantastic, right? They understood who I was. They put everything into perspective. They contextualized what could have been very confusing information. They engaged me with the way that it was all told. And I thought, why don't I see more of this in healthcare? And really that's, I think that's the question we all ask. And all the promise of AI and all of these, things actually, I think, are possible. And And that's, I think, the goal, hopefully, that's where hopefully healthcare systems actually want to go, that they want to provide more than, we'll show the same video to everybody, but we know specifically why Greg is here, and specifically what he's trying to achieve and where he's coming from, and let's give him the right information to help him have a good recovery, have a good experience, and write a good story for the healthcare system.
Maybe you could delve in and give us some specific examples on how you've successfully deployed digital storytelling, within different healthcare settings that may address some of the issues about driving behavioral or lifestyle changes.
Sure. So now we get down, obviously, we are not at the point of integrating our stories in a super personalized way. I would say that the health system itself isn't quite there. So what we're doing is sort of looking at, we have a patient population that has similar issues. We have similar problems. We need to communicate information to them. We know what we're doing now, which is largely we give a handout, a printout of what to do, and we find that that's not effective. And so we need to find a better way to communicate with our patients. So one of the examples is something that we did with Boston Children's Hospital. So one of the challenges that they had was with NPO instructions. So children that are coming in for a surgery, they need to know, and their caregivers need to know that, beginning at midnight the night before and before the surgery, they should not eat or drink, because if they do, then we're going to have to reschedule that surgery, which impacts the hospital. It's a cost to that hospital, because now that surgical room isn't being used. We're going to have to rearrange everyone's schedule. It's bad news for the parents and for the child, because now that surgery that was supposed to happen today is going to have to be rescheduled. You're going to have to go away, and then we're going to have to do this all again the next time. So that really is not a great thing, to do. And, Boston Children, we have a pre-surgical consult. We talk to the parents about why this is important. We give, the printed information, and still that, that percentage wasn't moving. And so the idea is, how can we tell this story maybe in a different way? So a lot of times with kids, we use that narrative storytelling in our animation. And then this, we see a cabin, and we see the window come up, and Goldilocks comes in, and she sees 3 bowls of porridge on the table, and she goes up to have a bite of the first one, and the light comes on, and Mama Bear's holding Baby Bear and says, "Don't you have surgery tomorrow? You know you're not supposed to eat." And so we present the same information, right? We talk about why it's important and what's going to happen, but it's not a boring sort of 2-paragraph text about this. It's a compelling story with dialogue, and we can hear some of the questions and the anxiety that that Goldilocks has about why do they even tell me this seems stupid, this seems mean, I get hungry when I get nervous, and this is what I should do. And so when Mama Bear explains why this is important, and finally it dawns on her, like, okay, I think you're right. This is difficult for me, but I'm going to do this because I don't want to have to do this again. I don't want to have to do this twice. And so we did that in English and Spanish. The results and the feedback we got were just fantastic. So now not only are the kids sort of brought into the conversation, because before clearly the kids aren't going to read this feedback. And unfortunately, what I find a lot in pediatrics is, well, we only really talk to the parents. They're legally responsible. So we don't even really bring the kids into the conversation, which to me, we talk about patient-centered care. So where's that child when we're not even talking to them? So let's give them something they can understand and put into context for why they have this information, or why they're being told that they can't eat or drink. And it also then puts into context, because we don't know, are all those parents, we said earlier, only 12% of the US population is health literate. Does that parent have proficient health literacy? Can they understand and follow the instructions in that? So in some ways, providing that animated narrative story, not only to the kids, but to the parents, so they can make sense and understand that as well, without making them feel they're being talked down to. So that's one example of, I think, how, hospitals and how we've helped hospitals bridge that gap. So use that narrative storytelling in a clinical setting.
Yeah. So I think that's really important to kind of maybe underline a few things you said, Tim. So the context was important. You created a clear, compelling vision for the future, why that was important. So whether it's pediatrics, whether it's sports medicine or the veteran, right? Each of them, you kind of met them where they are. And that's why it's so important to do this work, not generic, just, here's what Greg had, the experience Greg had, here's the 30 pages written by the lawyers that comply with the requirement, but you actually met the patient where they are. And I think that's just an important lesson for, like I said, whether it's sports medicine, the veteran, or the pediatric patient. And then even within pediatrics, like you said, you were dealing with, sort of a very specific service line within that care setting. So this work is very complex. But it does seem like the vision for the future is where technology can help, like, support all this, right? We don't have to know all this, but we can leverage the technology to kind of build that tech stack that creates that kind of outcome.
That's right. And eventually, who knows where that becomes. So not only that video, but that intelligent, agent, that chat bot that has a more Socratic response, instead of saying, hey, let me just give you all the answer. Well, Greg, how do you feel about that? And what do you think? And sort of leading that, because we know that's how we learn, not just by, hey, let me just give you all this information that you memorize, but in that conversation. Clearly, that's what doctors and nurses, do in their patient education, but they're spread so thin. And so when they do come in, ideally, that intelligent agent, that AI, maybe can, cover some of the basics, right? So if I don't know anything and I can start learning as I'm waiting for my doctor or nurse to come in, I can watch a video, I can interact, I can start to educate myself. And then with the doctor, the nurse, the therapist, comes in, then we can spend our time more effectively. And the more technology and AI can take off of their plates to free that time up, so that we really do get back to, patients and clinicians having more time together. I think that's that's ultimately the goal.
Well, there are different demographics, right? Obviously, the younger populations, even the baby boomers, are more likely. I do know with my mother-in-law's, who's in her 80s, she'd much rather hear it directly from the doc, right? And
right.
Doesn't matter how great these tools are, she's just not going to do it because that's her comfort level.
Right.
Well, even a parent, even if you're a parent and it's your kid, you're going to want to hear it from the doctor or the nurse or the person, right?
And that's true. And that, I think, largely is the perspective of the doctors, and they're like, they would much rather do that. Although we've been involved in some smaller studies that didn't really bear that out. That that the both the kids and the parents said, hey, I actually prefer that video. And one of the things is that I can watch it again later.
Right.
And a lot of times, sort of in that care setting, they came in, but it was so early in the morning, or I just had my pain medication, I wasn't thinking straight, and they gave me all this information, and I tried, and they kind of wrote it down, and I'm trying to make sense of it, but 2 hours later, or when my husband or wife or someone else comes in and says, what did the doctor say? So a lot of times having a video, having something like that is it's not either or, right?
Right.
So it's a both and sort of situation that supports, and there's all kinds of different learners. So some are more visual, some are more audible, some, everybody learns in a different way. And so the more intelligent, the more AI that we know, well, what's, Greg's learning style and how is he going to receive this information versus how would Keith or how would Tim, and it can be individualized. I mean, that's the holy grail, so to speak, of where we would like to go. But none of that sort of says, well, now we don't need the nurse anymore to come in and do patient. Like, no, that's not the case. We still, that's the key. That's the number one thing. What we would like to do is just help that process.
Yeah, well, I think that's where design plays the role, right? You
Of
design
course,
for
right.
that clear communication that downstream addresses. So you make sure in the design process that it's not like overly complicated in the beginning. You're kind of leading them on a journey, and that it doesn't contradict itself. And that as you go, and then by the time they get to where they actually are talking to the clinician, it all kind of ties together and makes sense because it was designed to do that.
That's right. That's right. Absolutely.
Or it could be based on your profile and how you like to learn or receive information. What's the right mix of clinician interaction? And obviously, if you're really sick, that's a lot different than treating something at home. So I think there
Right.
is a huge opportunity for AI, but how do we really integrate it in with the care process? And what is the receptivity to the culture of using these more advanced technologies?
I think we all do every day, right? I mean, we have our phones. There's social media. There's, Khan Academy. There's so much, out there that really, we're using. And I do understand that healthcare is risk averse. So, and so like, well, my bank is, farther ahead than, we hear that sort of comparison a lot. And, we do see that, well, why is my mortgage company doing a better job than my hospital communicating basic, information? And I don't know, it's complex, right? I mean, that's the theme of this whole webinar series, is that it's so much complexity, and with HIPAA and all the different regulations. So it's, and then you see, well, we can roll that out. Microsoft or Google can roll this out in a non-clinical setting, but all of a sudden, like, yeah, the AI is telling people to eat glue. So, oh, geez, so, but if that happened in a clinical setting where, they were telling them to take the wrong medication or taking too much of the wrong like, then that's a much more serious, thing. So we need to make sure that we get it right, and until we know, then we're going to move, very slowly. So I think healthcare, by its very nature, will probably be somewhat behind where maybe other industries are, but the potential is enormous. And I just think that this idea of, again, going back to the storytelling idea, that it's not just data and it's not just information, that the way that it's presented, the design of the delivery of that information also makes a big difference. And so for healthcare organizations to understand, get away from the data dump, understand the complexity of how how people receive information, and use those tools constructively, you can manage that complexity as well.
Well, Tim, this has been great. It's all we have time for today, but loved all your insights you shared today. You provided a lot of context, especially some of the leading edge projects you're involved with. So, in summary here, you gave us great insights about effective storytelling to transform education and engagement. You identified how storytelling can simplify complex concepts. You provided some compelling stories about how storytelling can impact outcomes, and you shared strategies on how you can effectively implement storytelling within different settings. A lot of our discussion, it kind of lines closely with some of Spyglass's research that we've done on patient engagement over the last several years. For those of you not aware, Spyglass is a product and go-to-market advisory firm focused on disruptive technologies and growth opportunities within the healthcare and life sciences industries. We have more than 250 customers who are leading technology companies, management consulting firms, healthcare providers, and investment organizations. We've published more than 30 market research reports on a diverse set of topics, including mobile computing, digital engagement, telehealth, and clinical surveillance. To explore our extensive library of paid research and gain deeper insights into how technology is reshaping healthcare, I encourage you to visit my website at www.spyglass-consulting.com. So, Tim, thanks again for your valuable insights and perspectives, and thank you to our sponsors, Simplify Medical and Storage Systems. Tim, would you like to provide any closing remarks that you'd like to leave the audience with today?
No, just, I really appreciate you having me on here. It's been a great conversation. I really appreciate the opportunity, and the whole series. I think has just been, I learn a lot, from all the speakers. So it's a great series. I'm happy to be a part of it. I'll just go back. I think the message that I had at the end of the last one is really still the same. So, we talk about those three narratives, and we don't know where that patient is. But really what we want to do is make sure that we don't sort of trap that patient in that chaos narrative. And so I think there's a real responsibility for the healthcare, systems to make sure that they're communicating, properly, helping their patients, not only clinically, but cognitively understand what's happening to them and help them write their own stories so they're not confused, so they're not feeling frustrated and stuck in a chaos narrative. And so that's the takeaway. Have a little more design intention in the way that you communicate to those patients to help them on their journey.
Awesome. Keith, any final thoughts you'd like to share with our audience today?
Well, I just want to thank Tim for taking the time. And Tim, thank you for your leadership. Really impressed with the work you've done with the VA, with children's hospitals. It's really exciting to hear that type of storytelling is benefiting patients and health systems. And I'm looking forward to the Greg Malkery sports medicine series that could come out in the future.
It's on the agenda. But now I am inspired now to look at all the videos that I get in my Facebook feed of outrageous accidents. The stupid things that we do, we don't understand the implications of it. Well, at Beyond the Blueprint, we look forward to continue our conversation with you in the future episodes of this series. And Tim, I hope that we can invite you back to have another informative discussion.
Yeah, absolutely. I'd love to do it. Thanks.
Thanks, guys.
Thank you.
All right. Thank you. Take care. Bye.